Dr. Tina Alster co-authored The Essential Guide to Cosmetic Laser Surgery. Tina Alster, good morning. Nice to see you.
Good morning. Nice to see you.
We know each other from our Washington days.
That's right. Good to see you up here.
I was not a patient.
That's right. You don't need to be.
Well, who knows? What types of skin condition can laser surgery help, Tina?
Well, we can treat all types of things, from red birthmarks like Gorbachev has on his head, to aging spots like those brown spots from the sun, to wrinkles, to tattoos, to even certain types of scars from acne or from burns.
The after pictures really are pretty amazing, aren't they? Are you yourself amazed what this technology can do?
Absolutely. 10 years ago, when we all started using more of these dermatologic lasers, we had no clue that we would be able to do as much as what we're doing today. Unfortunately, everybody always thinks that lasers are magic wands and they can just come in at their lunch hour, have a little bit of laser surgery, go straight back to work, and in essence have an easy in, easy out type of surgery. The only person that it's easy out in, easy out for is the surgeon. Most of the time there's some downtime associated with the laser surgery.
How much time does it take to heal? I guess it depends on what you have done, but generally.
Right. Well, if you were going to have, say, a sunspot or a spider vein removed, you could conceivably go back to work with a little bit of a bruise or a scab. However, if you were going to be going through laser resurfacing, which was shown in the video footage, you would need to take at least a week off from your regular work or social activities.
But that's a lot less than you'd have to take off if you had, say, plastic surgery, because the scarring and the puffiness and the swelling from that takes several weeks, right?
It could, but this is another thing that people get confused about. They think that laser surgery really is much easier than plastic surgery, and some of it is. But with the resurfacing in particular, you really do need to be out of commission quite a bit of time, during which time the new skin comes into place. And it's a painful process with some swelling and oozing.
Is it oozing? Ugh. Is it risk-free totally?
Absolutely not. Certainly you'd want to go to somebody who has quite a bit of training with the laser or lasers that he or she is using. There's always some risk with any type of surgery. Laser surgery is still surgery, and with it comes some risks. You could have scabbing, which could eventually lead to scarring if it got infected. Certainly you can end up with light spots or dark spots on the skin. Most of the time they are transient or temporary in nature.
Is it expensive?
It depends on the lasers that are being used. If you just had one spider vein on the leg or the face, it may only cost you $100 or $200. That's relatively inexpensive for laser surgery. If, however, you were going to go through full-face laser resurfacing to get rid of acne, scars, or wrinkles, it could take several $1,000s to have that procedure done.
Now, people who are watching who might be interested need to follow some steps, because you want to go to someone who is very competent when it comes to laser surgery. So you have some questions that you should ask, or anyone should ask if they're interested in this. How much training in the field of laser surgery? That's something you need to ask the surgeon.
Absolutely. You certainly don't want to go to somebody who just went through a weekend course and then is trying out the laser on your face. You'd want to go to somebody who's done at least, I'd say, 50 cases before I would have somebody perform laser surgery on my face.
And you need to ask that individual if he or she has published or lectured on the subject of laser surgery.
That's right. I think that shows that the person has a real interest in laser surgery.